Hello everyone, my name is Sumaya and I will be presenting on cysticercosis, which is a tissue infection caused by the larval stage of pork tapeworms that are known as Taenia solium. Classification of Taenia solium, so the domain is Eukarya, kingdom is Animalia, phylum Platyhelminths, class is Castoda, order is Cyclophilidia, family is Ctenidia, genus is Taenia, and the species is Taenia solium. Moving on to the etiology. So, cysticercosis is a parasitic infection caused by the larval stage of the pork tapeworm, typically known as Taenia solium. It occurs when humans accidentally ingest the tapeworm's eggs, leading to the development of cysticerci, in tissues such as the brain, muscles, and eyes. Tapeworm's eggs are known as cysticercus. The definitive host are humans, and the intermediate host are pigs. Epidemiology: Cysticercosis is endemic in areas with poor sanitation and open defecation where pigs are raised freely, often consuming human feces. It is prevalent in Latin America, Southeast Asia, and parts of China and India. The travelers to endemic areas can also acquire the infection by consumption of undercooked pork meat or eating contaminated food and water. Life cycle of Taenia solium. So in the GI tract of pigs, the eggs of Taenia solium transforms into a stage known as oncosphere. Oncosphere is a stage whereby it contains hexacathons with outer covering of the eggshell. So when the oncosphere gets into the intestine of the pigs, the alkaline environment dissolves the eggshell, resulting in the release of these hexacathons. Hexacathons are a form of larva having six hooks as shown in the picture, allowing for it to attach to the lining of the small intestine. The initial development of cysticercus occurs in the bladder-like stage inside the host tissue. The early invagination stage shows the development of cysticercus since it starts to form scolex with hooks and suckers. The appearance of hooks and suckers are essential for the attachment to host intestinal wall when it matures to a adult tapeworm. A fully developed cysticercus shows evaginated scolex that attaches to the host. Cysticercus with evaginated scolex are ready for attachment in human intestine once ingested through undercooked pork, and the scolex that remains of the bladder represents the transition from cysticercus to an immature tapeworm. Lastly, the anterior end of the young taenia. It highlights the scolex with hooks and suckers, with the developing proglottids that contains the reproductive organs producing eggs. Moving on to the pathogenesis of cysticercosis. So it involves the migration and development of Taenia solium larvae within the human tissues, causing inflammation and tissue damage. So to begin with, humans they acquire Taenia solium infection by ingesting raw or undercooked pork meat that contains cysticerci. The ingested cysticerci develops into adult tapeworm in the human intestine by attaching to the intestinal wall. It grows in the intestine and produces proglottids that contains the reproductive organs that produces eggs. So once each segment is filled, it breaks off from the tapeworm's body and is passed out with feces. Now the feces with egg-filled segments contaminates the soil and water, especially areas with poor sanitation and open defecation. Humans ingest these Taenia solium eggs by contaminated food and water. It hatches in the intestine, releasing oncosphere that penetrates the intestinal wall and enters the bloodstream to various tissues such as brain, eyes and muscles. However, in pigs, so the pigs ingest human feces, which is known as caprophagia, whereby the eggs hatch into hexacathons. The hexacathons then attaches to the intestinal wall of the pigs and then penetrates into the muscle, which is then consumed by humans by eating undercooked pork meat, and this cycle continues. Clinical manifestation depends on the location and number of cysticerci present in the body. First one is neurocysticercosis. It is the infection of the brain and spinal cord whereby cyst develops in the brain. It is the most severe form of cysticercosis, which can cause seizures, headache, hydrocephalus, meningitis, and neurological deficits. And the severity of the symptoms depends on the number, size, and location of cyst in the brain. Second one is ocular cysticercosis. It is the infection of the eyes leading to vision problems, including loss of vision if cyst is located inside or around the eye. The third one is muscular cysticercosis. It is the infection of muscles, which is often asymptomatic but may cause muscle pain and swelling. Last one is subcutaneous cysticercosis. It is usually painless with palpable nodules under that is present under the skin. Laboratory diagnosis of cysticercosis involves a microscopic examination of stool samples for the presence of gravid proglottids or the eggs of Taenia solium. Second one is formal ether sedimentation method. It involves addition of formalin and ether in stool sample and then observing it under the microscope. Indirect hematogglutination test, it detects the antibodies against Taenia solium. And early stage of cysticercosis has increased number of eosinophils in the blood. Treatment of cysticercosis includes the following. First one is antiparasitic medication such as albendazole and mebendazole that inhibits the growth of larval cyst. Anti-inflammatory drugs such as corticosteroids reduces inflammation caused by the dying cyst. Surgical intervention can be required for cases where cysts cause obstructive or life-threatening symptoms. And the last one is symptomatic treatment, including anti-epileptic drugs that manages seizures in neurocysticercosis patients. Last one in my presentation is the prevention and control. So the first one is hand hygiene. Wash hands thoroughly with soap and water before eating, preparing meal, and after using the restroom. Improved sanitation, ensuring proper disposal of human feces to prevent contamination of soil and water sources with the tapeworm egg, and usage of sanitary facilities and avoiding open defecation. Food safety includes cooking pork thoroughly to kill any larval cyst present in the meat and avoiding the consumption of raw and undercooked pork products. Food handling prevent the cross contamination in the kitchen by using separate cutting boards and utensils for raw meat and other products, and educating the public, especially in endemic areas, about the transmission risk and prevention of cysticercosis. And travelers to endemic areas should take precautions by ensuring that they are consuming well cooked pork meat and are drinking safe water. These are the references, and thank you.